Hello again. Did you know that we have a Mindfulness Mondays at Georgian College? Every Monday, we get tips and strategies and activities on how to bring mindfulness into our lives. These are brought to us by Dr. Sarah Hunter on behalf of the mindfulness community of practice at Georgian College. Our next talk is about research related to mindfulness, specifically a strategy for healthcare workers to combat burnout during COVID-19. We could all benefit from incorporating into our daily lives. Dr. Sarah Hunter is a writing center technologist at Georgian, an emerging researcher and student affairs practitioner at Georgian College. Sarah is versed in the practice of mindfulness and is interested in exploring its potential to build social and emotional competence and well-being. Sarah received her PhD in educational sustainability from Nipissing University. Dr. Hunter is joined by Nadine Pro, research assistant with Georgian's Department of Research and Innovation. Nadine is a graduate of our research analyst program and completed her co-op student as a research assistant with the Department of Research and Innovation. Nadine also has a bachelor's of science in psychology and biology. Nicole Adams is a research analyst at Waypoint Centre for Mental Health Care. Nicole has a BA honors in psychology and a master's of science in kinesiology and health sciences. For her undergraduate thesis, Nicole examined the role of perfectionism and self-discrepancy on body image and presented her findings at the Canadian Psychological Association, the CPA, annual convention. During her master's, she dove into the health behaviors research stream, where she explored oxytocin and genetic links with overeating behaviors and examined the relevant factors such as reward and punishment sensitivity. Nicole Mace is an organizational development consultant for Waypoint. Nicole is an organizational leads facilitator for Mindfulness Without Borders Mindfulness Ambassador Program.
Thank you very much. So as we begin today, we'd like to acknowledge the support of the Natural Sciences and Engineering Research Council of Canada and NSERC, who funded this study. Today, we're going to share with you our findings of a study where we investigated the efficacy of a 4-week online mindfulness program on building resiliency and mitigating healthcare worker burnout during the COVID-19 pandemic. So to begin, there is an importance here today of a shared understanding of mindfulness. The first image that comes to mind is someone meditating in silence. However, as our awareness about this concept expands, there's greater understanding that secular mindfulness practices can be accessed anytime, anywhere, not just during meditation. John Kabat-Zinn, a medical doctor, often credited for bringing mindfulness into Western medicine, and the founder of mindfulness-based stress reduction, describes mindfulness as a practice that involves focusing awareness on the present moment and accepting and acknowledging one's feelings, thoughts, and body sensations without judgment. Simply put, it's about cultivating awareness and paying attention, with attention, the present moment. For today's session, we'd really like to start by taking a few moments to invite you to arrive here into the present moment. We invite you to begin by making any adjustments that might help you cultivate presence. Maybe it's closing a browser tab, maybe it's setting down a device or adjusting your body, but just invite yourself to make any small adjustment you can in your environment. And then we're going to invite you to take a moment to tune into your surroundings, cultivating first an awareness. Maybe it's looking around, maybe it's noticing what's beside you, what's behind you, what's in front of you, maybe looking out a window if you can see one, just noticing where you are right now. And then if you'd like, we invite you to close your eyes or to take your gaze around or an object, somewhere that you can return it to if you become distracted. Just to take a moment here, ground yourself into the earth, soles of your feet on the ground. Maybe it's noticing the sit bones on the chair beneath you. Taking a moment to soften the body. Maybe resting the shoulders a little further away from the ears. Lengthening the crown of the head a little higher towards the sky. Unclenching the jaw. And softening the cheekbones. And then just find your breath. Maybe your breath is slow, and maybe your breath is fast, and that's okay. Just notice. You don't need to breathe in any special way. Just take a few breaths for yourself. And then as you slowly bring yourself back to the room where you are, maybe it's wiggling the toes, fingers, allowing eyes to adjust to the light in the room, just inviting yourself into this space. Transition perhaps from a busy day here into this moment. And now I'm going to pass things on to Nicole to get things started.
Sarah, for that lovely grounding experience. My name is Nicole May, and I'm an organizational development consultant for Waypoint Centre for Mental Health Care. And before we get started with the research, I just wanted to take a moment and introduce you to Waypoint's mindfulness journey, the retooling of our mindfulness program, and the impact that has on us and our frontline staff. So Waypoint's mindfulness journey began in 2015 when the organization decided to implement the National Standard for Psychological Health and Safety. Implementing the National Standard meant building structures, systems, and services to support the mental health and well-being of our staff. It involved having pillars in place and looking at program design, what existed, and what we should start to implement as an organization. Where we started was looking at a robust wellness programming and looking at how we could add more to it. What training could we add to make it richer for our staff and support their mental health and well-being? Our focus was building resilience. So building resilience started with looking at mindfulness. And we decided to pilot the Mindfulness Ambassadors program as a training tool to introduce our frontline staff to mindfulness and to support their growth and development in the area of resilience. The Mindfulness Ambassador program is a tool that's provided by Mindfulness Without Borders. It seemed like a good idea to start there, and so we decided that we would pilot this 12-week program and see what happened, how the staff received it, knowing that if we were going to keep this program within the organization, we had to have a sustainability model. And that sustainability model would look like organizational facilitators. Looking at this mindfulness program and how to integrate it, we got our ducks in a row and Waypoint launched the first 12-week mindfulness ambassador program at the organization. And it was really exciting. We had high wait lists, high participation numbers, and the amount of engagement was just simply impressive. The attendance was the highest the organization has ever seen. So we knew we were doing the right thing. Now with having the mindfulness program piloted, we needed to take a look at those organizational facilitators again. And we decided that we would train those mindfulness facilitators in the MAP program. Training the mindfulness facilitators meant that we would have a sustainability plan that would allow us to have rolling program registration and ongoing services throughout the organization. And the other piece that was really important to having a facilitator team was ensuring that the team was a group of people that the participants could relate to. So having the team group with clinical and non-clinical employees providing the mindfulness training and programming and making sure that there was a balance of personalities. So each program participant had a higher likelihood of really relating to one of our facilitators. This program was highly successful and it was integrated into some of the clinical programs and then further integrated into the organization by adding it into our leadership development program. It was really working for Waypoint. So when the pandemic hit and we had to take a look at what we were going to do for a mental health strategy, it made complete sense to focus our efforts on mindfulness. What you can see here is Waypoint psychological health, safety, and management response to COVID and how we had the employees' mental and emotional well-being at the heart of all the programming. The programming that I want to focus a little more attention on is the mindfulness programming that we did in time to provide support to our frontline staff. Mindfulness was a key element during the pandemic of providing support and ensuring that we were still taking care of ourselves and filling our cup of resilience so we could then care for the patient. So how did we retool the mindfulness program? So the original MAP program was a 12-week program and it was a face-to-face program and an hour in duration. So it was a significant commitment for participants. Seeing that the pandemic was having quite a significant impact on our time and our normal routine, we wanted to retool the program to make it less of a commitment, but enough of a commitment to make a difference. We needed to retool it to make it so it would be accessible. So it needed to be on an online and virtual platform. It needed to be simple, a 30-minute time frame, and 4 weeks get people used to participating and getting into the habit of doing mindfulness. Shifting from a 12-hour to a 2-hour program meant that we had to take a look at what parts of the program we were going to focus on and what skills we wanted to develop while we were taking care of these frontline staff. What we focused on was emotional awareness, building empathy, incorporating a basic breath practice, reflection, and then adding in a longer practice with the intent intention of providing experiential learning, but also in-time care for the participants. The longer practices included mindful listening, loving kindness, a body scan, and mindful movement. Mindful movement was an interesting one because if you can reflect on that time when the pandemic started, most of us were stuck in long lineups, and that was quite an anxiety-provoking experience. So that was one that was quickly relatable to by our participants and applicable during the pandemic. With this content, we wrapped our participants in compassion and caring, and we then started to offer the program, and it was extremely well received. We've had over 700 registrations, and we've had a strong partnership with Mindfulness Without Borders and Georgian and Waypoint to understand the tool, which we're going to get into next. But most importantly, we now walk away with a new tool for our frontline staff to add to our current existing mindfulness program so we can engage in ongoing services and continue to build their resilience and support their mindfulness journey.
Healthcare professionals are a high-risk group for experiencing burnout, and COVID-19 has only worsened this by increasing feelings of stress, depression, and insomnia in healthcare workers. To understand why mindfulness may be an important tool to help combat these negative feelings, we must first understand what burnout is. As described by Maslow and colleagues in 1996, burnout is characterized as emotional exhaustion, depersonalization, and reduced personal accomplishment. Next, we need to understand what resiliency and self-empathy are. The American Psychological Association defines resiliency as a process of adapting well in the face of adversity, trauma, tragedy, threats, or even significant sources of stress. While empathy is commonly defined as the ability to understand and share the feelings of another, self-empathy is similar, but focuses on understanding your own inner feelings. Mindfulness is a practice that works to develop and improve skills such as self-empathy and resiliency, which help mitigate and manage feelings of burnout. Mindfulness-based interventions have been shown to benefit healthcare professionals through fortifying the immune system, reducing stress and anxiety, and improving overall well-being. The literature on mindfulness predominantly focuses on the more traditional mindfulness programs, which, as Nicole said, are face-to-face and long in duration. There is little research that examines the effectiveness of shorter and virtual mindfulness programs like the Retooled Mindfulness Ambassador Program developed by Waypoint. Together, researchers from Georgian College and Waypoint investigated the efficacy of this retooled 4-week online program. The objectives of this study were to investigate if this mindfulness program develops empathy, resiliency, and mitigates burnout, and whether these effects are sustained 4 weeks after the program. Healthcare workers across North Simcoe-Muskoka who enrolled in the online mindfulness program through the Waypoint Frontline Wellness Program were invited to partake in this study. Consenting participants completed a pre-survey prior to starting the mindfulness program, a post-survey after program completion, and a follow-up survey 4 weeks after completing the post-survey. In this study, we used a demographic questionnaire to assess age, gender, and previous participation in the mindfulness program. The 12-item abbreviated version of the Nicholson-McBride Resilience Questionnaire was used to assess the capacity of participants to bounce back from extreme occasions or even to triumph in the face of hardship. We used the Interpersonal Reactivity Index, which is a 28-item scale assessing the 4 components of empathy, which are 1, empathetic concern, which is described as feeling emotional concern for others. Perspective taking, that is cognitively taking the perspective of another. 3, fantasy, which is the emotional identification with characters in books and films. And 4, personal distress, the negative feelings in response to others. The final scale we used was the Maslow Burnout Inventory, which was used to measure the 3 aspects of burnout: emotional exhaustion, depersonalization, and personal accomplishment.
Thank you so much, Nadine. You can see that reducing burnout with mindfulness techniques is key for success in career and home life. Thank you for helping us take a breath, especially you, Sarah. That was really wonderful. Thank you for being here with us today.